moving along with breathing, I'd like to talk to both Kalia and Melissa now about what sorts of things they do or how do they use breathing in their practices. So I'd like to start, Melissa, with first asking you that, I've had a lot of massages in my life, but I've never had any massage therapist really use breath during a massage. And so I'm really curious to hear how you incorporate that into your sessions.
Breath work, I incorporated a few different ways into my massages. Oftentimes, it's a little bit of all these different ways throughout the session, but it also depends on what the needs and what comes up during the session. But breath work, sometimes I'll start off my sessions with some breath work on the table once the client's already on the table, maybe facing up. We'll start off by doing like a body scan, sort of. So I'll have them, I'll close their eyes and invite them to start doing some breath work with me, and really paying attention to what comes up in their body while doing the breath work, and letting the body guide us in that way. And the benefits of that, it can be very physical, and it can also be very uh, emotional. So it just depends on what the goals are. I would also incorporate body work in, when doing maybe some stretches. I'll invite the client again to take some deep breaths as I'm doing the stretches, or if I notice that they're maybe resisting while I'm trying to move a joint. It happens a lot in the neck. I notice a lot of people tend to guard a lot in their neck. Maybe I'm working the neck, and they'll want to help me by lift up. Maybe it's very subconscious. I don't think a lot of times they don't notice that they're doing it. So I'll be working on the neck, and I notice that they kind of want to help me lift it, and I need the muscles to be relaxed. So it's almost like redirecting the brain and redirecting their focus by inviting them to do that breath work with me, and they usually immediately release, and I'm able to do the body work that I need to do. So it's usually like that when I'm doing stretches. Also, if I'm doing certain stretches, um, we'll further stretch with the breath. So it just depends on what the situation is, but it is used throughout the session. I incorporate it throughout my sessions.
That's great. Yeah, I really would have loved to have had a massage therapist kind of guide me in that way. I know that I tend to carry a lot of stress in my neck or even in my back. Do you use diaphragmatic breathing or what? Any particular technique or anything like that?
Once we're on the table, I don't yeah, we're not too particular. It's just take deep breaths, and then after, a lot of times we'll go over different breathing techniques that they can start incorporating outside of that space with me. But yes, diaphragmatic breathing, making sure that they're filling up their belly with air, and then the chest type of thing, and then releasing it. But usually it's just take a deep breath with me, and then I'll breathe in, and they kind of follow along type of thing.
I think that's really important in therapy. I'm constantly using the breath with patients, whether it be pain or they're just sort of struggling through an exercise. And certainly, I do see people that hold tension in certain muscles. So I think that's great use during a massage to help somebody really be able to acknowledge, where they are holding that tension and how do they just relax into it so you can work on those muscles a little bit better.
Mm-hmm. Yeah, I'm really glad you brought that up because pain, because the breath is something that we can actually control. It happens naturally, without us thinking. We breathe, but we can control it, and I think that's for a great reason, right? And if you think about what breath work has gotten us through as well, especially as women having children, like they do their breath work to get through labor, and that's a lot of pain, and the breath work can help ground into that moment and get through that. So I think that being able to control that breath, and being able to mindfully do it can help us get through a lot. Hmm.
Yeah, yeah, absolutely. So if you have a patient that comes in, or client, I don't know which term you use, I guess it could be interchangeable, that you find that tends to hold tension in the same muscles repeatedly. Each session they come in and they're still holding that tension, which is can absolutely be the case. Posture might be an issue. Um, just natural stresses of where people hold some of their emotions and things like that. Do you have any tips for people that you leave them with when you're, say, hey, this is what I'd like it's your homework to work on before your next session, just to help keep things sort of looser, like when you leave?
I do typically give them homework, whether it's breath work to continue doing at home. Usually it's always, learning to become self-aware, of what's going on in their bodies. That way we can just kind of be aware of and conscious of where we're holding our tension. And that so there's homework that's done, whether it's breath work, stretches, maybe even suggesting journaling, that always helps. And doing acupressure points. I'll work on some usually when they're there with me, but I'll also teach them a few points that might work for them for that time before their next session with me.
Oh, that's great. Okay. Well, since we're talking about breathing, would you mind sharing with us any acupressure points people might be able to use to help with breathing?
I don't mind. I'm glad to share. One point that we could work on that has to do, well, let me tell you guys a little bit about acupressure. And the acupressure that I know, I've been trained in Shiatsu massage, which is actually a Japanese modality. We use acupressure points. We work on acupressure points throughout the body, do joint mobilization and stretches. So that's what, pretty much what Shiatsu consists of. And it is Japanese, but it's based on traditional Chinese medicine. So they do work along the same meridians that traditional Chinese medicine is based off of. So the meridians are essentially energetic pathways in the body, and all of them are assigned to the major organs in the body. So the one that I'm going to show you guys right now is it has to do with the lungs. So it'll help with breathing. It'll also help with any upper back tension, shoulder tension. So yeah, so this one is lung one, and it's also known as the central treasury because it's a potent point where we hold all of the chi for the lungs, so all the energy for the lungs. So we can find
Melissa, if I can interrupt really quick, if anybody has any questions for Melissa, please feel free to leave them in the comments section, and we'll try and get those answered. Whether it's today or at a later point, if you're watching a replay, feel free to ask questions there as well.
Okay, so lung one, the lung meridian is bilateral, so it'll be on both sides of the body, dividing the body, right down the center. It'll be on both sides. So you can pick a side. It doesn't really matter which one. I'm gonna use the opposite hand, so my right hand, to reach over to my left side. So I'm gonna start here along my collarbone, and I'm gonna go right along the bottom of the collarbone, and I'm gonna follow the collarbone all the way to the side where we find the joint for the shoulder here. Okay, and then you're just gonna, with using just your fingertips, we can just kind of press in here. You can use medium to firm pressure, whatever's comfortable to you, and you'll know you're on the point because it'll feel really tender. So again, we're gonna follow that clavicle, um, and once we get into this corner, and I'm moving my shoulder just because it helps me find that edge, right? That edge right before the like where I'm meeting, where the chest and the shoulder are meeting, or the arm are meeting. But here I found a little spot that's pretty tender, so to me that's lung one, and I'm just gonna press directly into it. If you have any type of sensitivity in your fingers where you're not able to press in, you can use a firm, just your hand, your feet, all of your fingers, or maybe even your palm, and just apply some general pressure into that area. But we want to hold it for about a minute. And usually press in. Take a deep breath in through the nose. And exhale. And on every exhale, I apply a little bit more pressure, sinking in a little bit further. And you don't have to sink in on every exhale. It's just whatever's comfortable for you. And again, while we're doing this, I always invite folks to pay attention to what's coming up, if there's any sensations coming up in their body while they're pressing on the pressure point, any emotions that may be coming up, visions, or any particular colors coming to mind. Just see what comes up for you while pressing on to that point. Okay. And that's lung one. So yeah, you can just hold on to that as long as you feel like holding on to it. But I would say about a minute, maybe 2 minutes would be okay. And then again, we could go ahead and do it on the other side as well. It is on both sides. Another thing, if we look at the body here, not just energetically, through that traditional Chinese medicine lens with the meridians, but if we just look at what's happening here, we have our pecs, and right along this edge, they're connecting on this side. So when we start applying pressure on this side, it starts to slowly release any tightness that we might have in the chest muscles, which can also affect our breathing. So maybe, but if you look at just the anatomy of the body and what's happening here, what we have going on here, we have our chest muscles and the lungs beneath them. So if we can work on these points here, and it helps soften the pec muscle so that can give us more room to breathe too.
I've never really used acupressure points, so that was helpful and definitely ties in with all of our breathing to help, just the lungs really work better as well. So that's if it's an added benefit to open up the chest and open up the back, hey, I'm all for it, because I carry a lot of stress there myself. So, and perhaps those that sit at desks or on a computer a lot as well. I'm going to bring Kalia back into the conversation here and see if she has any questions as well.
Okay. Yeah, another thing, I'm glad you brought that up about the computer thing, because yeah, people, a lot of people are at the desk all day right now because they're working from home or doing distance learning, whatever the case may be. Maybe they're just spending a lot more time, at a desk. But yeah, doing this all day can tighten those muscles. And when we have our, chest muscles are pretty tight, then a lot of times we experience that pain in our upper back, in our neck, in our shoulders. So it's all interconnected, right?
Yeah, absolutely. Thank you for that. Kalia, did you have any questions or comments for Melissa?
Yeah, when you're finding the point, so like for me, like how you're talking about just your chest being tight. So I feel like right underneath my clavicle, more here, it's more tender than near the shoulder joint. But it's only in the specific spot in the shoulder joint. Is that correct?
Yeah, there's multiple points. So we have the lung meridian that goes from here all the way down the arm. So you might have been on a different pressure point, or might have been that one. So it's just usually you're on a point when you find that tenderness. So it might not be the one that we were working on today, the lung one, but it's still a point, and it still has to do with the lung meridian, so it'll still be beneficial.
All right. Well, thank you for sharing that with us, Melissa. Hopefully people find that helpful and can incorporate that into their breathing if they're feeling like they need a little bit of extra help, or help even releasing some tension in some of those areas. If you can't see a massage therapist, at least you can get a little bit of pressure points in there to help in the interim.
Mm-hmm.
Yeah. All right. Well, I'd like to ask Kalia about the use of breath in yoga. I know it's depending on the different types of yoga, but some maybe use it more than others. Not entirely sure. I won't pretend to know about every yoga out there, but if you have anything to share about breathing in yoga.